I am David Martinez. I direct our grants program for Vitalyst Health Foundation. I'm joined today by my colleague, Michelle Goodthunder, our program manager for grants and partnerships, who will be monitoring the Zoom room and the waiting room for us. But this is our monthly virtual 101 session to introduce folks to Vitalyst Health Foundation, give you a bit more insights into our partnership opportunities and how we operate as a foundation in Arizona. Let's go ahead and get started. If you have any questions, feel free to utilize that Zoom room. And then after we get through these slides, we'll have a live Q&A so we can answer any questions that came up there, and also any other specific questions you have. We try to make these as open and accessible for folks doing amazing things throughout Arizona. So we have bilingual staff that are happy to connect with those folks who need Spanish, and you can email conversemos@vitalysthealth.org. We have closed captioning available via Zoom functions. All lines are muted, but as you have heard already, you can take yourself off of mute once we get to that Q&A. Continue to use the chat for questions. And this was being recorded, and we will post the slides and send them out to everyone that registered for this month's webinar, and continue to keep updated at vitalysthealth.org. So Vitalyst Health Foundation, if you're not aware, is a Phoenix-based foundation that has partnerships throughout the great state of Arizona. Our vision is that everyone in Arizona are healthy and resilient, and we are on a mission to see that through by connecting, supporting, and informing efforts that improve the health of individuals and communities throughout Arizona. You'll see throughout the clarification of Vitalyst that oftentimes our mission, our goals, our priorities come in threes. So that connect, support, and inform efforts is really key piece of our mission. We are a health foundation, again, based in Phoenix, but we have partnerships throughout the great state of Arizona for efforts that are improving health throughout the states. While we are a health foundation, we see health as more than just health care, though that is a very big component of being able to live a healthy and resilient life. We look at the broader social determinants of health, or what you might hear these days be called the social indicators of health. We refer to them as the elements of a healthy community. You might have seen this elements of a healthy community wheel, or the wheel, that we often and affectionately refer to it as. And it really embodies the variety of ways that health shows up in everybody's life. And this intersectionality of these elements are a really key piece for you to think about. Am I mission aligned with Vitalyst? More often than not, a lot of the great efforts that are being done with community partners are mission aligned, as if they fall within these different elements of a healthy community. You see on there access to care. As I mentioned, health is more than just health care, but that is still a very important aspect and a really big piece of our work. But so is housing and transportation, and having parks and recreation availability, and a variety of all of these different elements. And of course, as a foundation, we hold health resiliency and equity at the center of our work, and really focus in on those efforts that are improving health with those lenses as well. If you don't see your specific mission or program area reflected in one of these elements, they probably still are included within one of the specific elements. If you go to vitalysthealth.org, and we have a page referring to the wheel, there's a deeper dive into what all encompasses each of these elements. So if you don't see your specific program area or mission connected with this elements of a healthy community will, it more likely than not is just reflected within one of these aspects. especially say, for instance, social and cultural cohesion, we see a lot, especially as we have a focus area on civic health, civic engagement, and civic participation. So a first question we often ask, are we mission aligned with Vitalyst? We use this to help guide that alignment, but there's further ways to align with Vitalyst that I'll take a deeper dive in as we go along this. As I mentioned, we like to do things in threes here at Vitalyst Health Foundation. So we implement our mission and vision through three goal areas. And each of these are really important, especially as we think about how, as a foundation, we operate and our efforts that we support through grant partnership opportunities. We work to support collaborative networks, working to improve the conditions that impact health. This is a very strong piece of a really strong goal for Vitalyst Health Foundation. We know that the type of work that needs to be done to improve health and tackle the root causes of the greatest health disparities in Arizona take more than just one entity. It takes a village. It takes a collaborative network or coalition of folks working together to improve health. So that is a specific goal of Vitalyst. At the same time, each of those collaborative networks are still made up of individual community partners that they themselves need to be strengthened. So our second goal area is to strengthen community partners and ensure that they are as equipped as possible to advance health equity. And you'll hear that framing a lot for Vitalyst as well, because it is a core value that we hold in our work. And the third goal area here is also really important as we work to inform decision makers to prioritize community health and well-being. We do a lot of advocacy and public policy at Vitalyst. And as a health foundation, we follow what is often seen in a public health space to tackle what is called upstream approaches to improving health rather than downstream interventions. All the interventions are really important, but as a foundation, we're focusing on these upstream interventions which often involve some sort of policy systems or environmental changes. Again, what are those root causes of the greatest health disparities in Arizona, and how are folks approaching those efforts in a systemic way to tackle that root cause? That is often done through policy and advocacy, which is why we have a big goal area and do our own advocacy and public policy, and also connecting back to that collaborative network piece of it. The systemic work is hard work. It can't be done simply by one entity. You need the collaborative network to help get it done. Each of those three goal areas are areas that are reflected both in our grant making side of the house, but especially in our programmatic priorities. So at Vitalyst, I like to say we have three sides of our house. We have our grant making side of the house, which I'll share more about in just a little bit. We have these programmatic priorities, which I'll touch on in just a bit. And then we have a fiscal sponsorship program called the Technical Assistance Partnership of Arizona, or TAP-AZ. A lot of you I know are very familiar with our team at TAP-AZ, and we work really collaboratively with them as our fiscal sponsorship program. We share offices and are all part of the same team. But there is a second, another process to explore fiscal sponsorship through TAP-AZ. So if you're interested in learning more about that, just go to tapaz.org. They also host monthly virtual 101 sessions. So if you want to take a deeper dive in all that encompasses fiscal sponsorship and getting support for back office finance and accounting, definitely go to tapaz.org for more information. But bringing it back to the one side of the Vitalyst House are our programmatic priorities. So yes, as a foundation, we do grant making like most other foundations, but we also do more operational work focused on these programmatic priorities. So in this instance, this is where we connect with community partners to identify those greatest health disparities and issues in Arizona that are of most importance. All issues are important, but as a foundation, where is our expertise in our lane to provide additional support that does not include any of the grant partnership opportunities through our grants program. These are strategies, again, connecting with those goals of supporting collaborative networks, strengthening community partners, and informing decision makers for each of these three priority areas. So here you'll see civic health, healthcare integration, and housing. I want to clarify too here, while these are the programmatic priorities of Vitalyst, again, you don't have to work within these three areas if you want to explore the grant making side of the house for Vitalyst. So don't fret too much if you're not reflected in this area. In this area, we have staff members that direct each of those portfolio areas. So I direct, in addition to our grants programs, our civic health portfolio, which is really focused on how Arizonans are coming together every day to tackle their toughest challenges. And as a health foundation, how those efforts are improving health. It really is, again, that systemic approach, focusing on what are those barriers that are restricting community from engaging in those efforts and in their government to tackle their toughest challenges. And that is especially driven by the systemic rules of the game around the census, how we're counted, in redistricting, how our votes are then distributed, and then in voting access, which, as we know, has been a hot topic for the last several years, the ability or the challenges for Arizonans to engage in our government through the ballot box and voting. Our healthcare integration portfolio is overseen by our colleague Anna Rossetti, who you see there. It is really about the intersectionality of the physical, mental, and social determinants of health, with a strong focus on healthcare again. Anna also oversees and is our point person for all of our advocacy work. So she's often at the state capitol and working with staff to let our voice be heard and raise the voices of our partners. The healthcare integration portfolio is very comprehensive, but again, focused on key aspects, including healthcare itself. So in this area of work, we have a collaborative network. Remember the goals that Anna is supports with Vitalyst and engages in very thoroughly, called the Cover Arizona Coalition, which, if you haven't heard of, is focused on helping Arizonans navigate healthcare systems, especially as we just are closing out open enrollment for our own state Medicaid system, access, and other healthcare issues. She also works to strengthen community partners within that collaborative network, especially those partners that are focusing on some of Arizona's greatest health disparities, like maternal and child health, our healthcare workforce challenges, and other public health issues like heat resiliency, climate, and sustainability. Other broader public health areas that, again, all integrate within the elements of a healthy community. Our housing portfolio is directed by Gabriel Jaramillo, who you see there in the nice blue blazer. Gabriel brings a wealth of knowledge around the whole spectrum of housing, from houselessness to housing affordability. The primary collaborative network that he works with here is the Arizona Housing Coalition, and then again support specific areas that are strengthening community partners in the housing space. Gabe himself does a lot of advocacy and public policy in housing, especially as we've had some great opportunities to pass legislation and invest in the housing trust here in Arizona. But we know there's still a long way to go with addressing the housing crisis in Arizona, especially in rural and tribal communities. A big effort that Gabe has really facilitated is these promising practices in especially workforce affordable housing, showcasing how what we call anchor institutions in our communities, like schools, community health centers, community colleges, and other institutions like that, can leverage their churches, can leverage their property to be connected with nonprofit affordable housing developers to meet the workforce affordable housing needs throughout Arizona. And then last but not least, you see our colleague Sergio Paris there, Paris, who directs our communications. So he helps tell our story at Vitalyst Health Foundation and also lift the voices and tell the stories of our partners as well. While Sergio doesn't direct a priority program area for Vitalyst Health Foundation, he often is our point for partners that are working in the education space and in the food system space as well, because of his background in education, philanthropy, and in food banking and food systems work. I note that because as folks are exploring partnership with Vitalyst, especially our grant partnership opportunities, we go through what is called the discovery intake process. And so keep in mind those phases once we get to that slide. So as I mentioned, we have our fiscal sponsorship program, TAP AZ. We have our programmatic priority areas in housing, healthcare, and civic health. And then we have our third side of the house, which is our responsive grant making program. The Vitalyst Grants Program is focused again on supporting collaboratives. Remember our goal, working towards systems change. Another key goal of Vitalyst, including advocacy and public policy. And we do that through a three-tiered grants program that you see here: the Technical Assistance Grant, the Spark Grant, and the Systems Change Grant. In total, these grants combined provide a grant partnership opportunity with folks up to a 5-year partnership opportunity, nearly $225,000. Vitalyst tries to practice the concept in philanthropy called trust-based philanthropy that provides multi-year funding as general operating dollars as possible, and other principles like removing or minimizing reporting and application processes and all of that to build trust with partners. So offering a multi-year grant like what our 3 grants are built upon really model that. As I mentioned, we have a discovery process that we have set up at vitalysthealth.org that allows any partner that sees alignment with Vitalyst, remember the elements of a healthy community wheel, one of our programmatic priority areas, or one of the 3 grant types we have to complete or go through our discovery intake process. At Vitalyst, in addition to having equity as a key value of ours, openness and transparency is another value that we have tried to embed in our grant making program by having this discovery process as sort of our open door. We have an open door policy at Vitalyst, so anybody can explore partnership with us. Again, that is aligned with our mission and finds alignment with our grant opportunities as well. So as you were going through this webinar and you're like, yeah, I do see alignment in a lot of different ways and would love to talk further, go to vitalysthealth.org, our grants and partnership page, read a little bit more about our grants. I'll take a little bit of a deeper dive into each of those grant criteria, and then completed that discovery intake form. Once we receive that form, we'll review it. Our colleague Michelle helps facilitate that process, and then is kind of like an air traffic control person. And she is accepting those discovery intake forms and then connecting that partner as they're aligned with one of those 4 directors who you saw in the previous slide, based on their portfolio area and what their background and expertise is in. So for instance, our colleague Sergio has a background in food systems. So he often facilitates our prospective partnerships with folks that are working in the food system space. Or if it's more so connected with housing or anything around the built environment and healthy communities, that would be Gabriel. And then something a little bit more aligned with healthcare, especially as it relates to access, our state Medicaid system, healthcare workforce, some of the other most pressing public health needs in our state, like maternal and child health, you would connect with Anna. And then we have an initial consultation call, a 30-minute conversation virtually to get to know more about your entity, your efforts, where you see alignment with Vitalyst grant partnership opportunities, and then if that alignment is there, follow up on next steps with our grant application processes. So now I'm going to take a deeper dive into the specific criteria for each of our three grant types. The first tier of our three-tiered grants program, as you saw, was our technical assistance grant. It is meant as a capacity building grant for collaboratives who eventually want to plan and implement systems change work. So if folks are familiar with Vitalyst, we had the technical assistance grants previously that supported nonprofit capacity building over the last several years in order to provide as multi-year funding as part of our systems change grants program. We streamlined and pivoted that grant program to away from supporting nonprofit capacity building and supporting collaborative capacity building efforts. Because again, one of our goal areas, we want to have a focus on systems change. It takes a village, and we know that collaboratives need, in many instances, the space and grace to build up the capacity of their collaborative to eventually work towards systems change. So we have set up the technical assistance grant as that space and grace. You'll see on this slide and in the next two slides where we take a deeper dive into the Spark grant and the systems change grant, these 5 grant criteria. So again, the 5 grant criteria that you see here on this slide, collaborative, health outcome, systems change, health equity, and budget, are the same 5 criteria that we have for the Spark grant and for the systems change grant. But what you will see is the definition and the specific descriptor for that criteria is a little bit different for each of the grant types because it really does depend on where that collaborative's journey is on this system change continuum. So if your collaborative is in a startup phase, you're convening your core partners or partners that you think should be involved in this space, engaging community to get feedback on what those solutions could be towards systems change. This would be the technical assistance grant that you would be most aligned with. So in this instance, the collaborative criteria has to be a lead entity. And for this grant, it could simply be one organization that is a nonprofit or fiscally sponsored entity serving Arizona that knows they want to build a collaborative and work towards systems change. Again, they just need a little bit of capacity building support. So for this one, it's at the very beginning stages. As we get on to Spark and systems change, you'll see the collaborative aspect is a bit more meatier. You don't have to have all of your partners identified for the technical assistance grants, but you should have potential partners identified, and potentially your grant could help cover that facilitation and convening of those potential partners. We're a health foundation. Our vision mission is to improve health here in Arizona. So our grant support is to improve health outcomes as well. And again, how we frame this is as aligned with the will, the elements of a healthy community will. So looking at the broader social determinants of health and a focus on community health as well, as opposed to a personal population health per se. Really, or excuse me, personal health. Population health and community health is more aligned with Vitalyst. As an entity, we work upstream, so that systems change criteria is a key aspect of it. Again, you don't have to have at this stage a specific solution yet identified. You're still focused on collaborative capacity building, but the collaborative does have to eventually plan and implement systems change. Our technical assistance grant isn't meant to just support coalitions or collaboratives that are probably doing amazing work, but not holding a systems thinking lens in their work or working on a specific systems change project. So that's a key criteria for this aspect as well. And again, as I mentioned, Vitalyst holds health equity as a core value for us. That's reflected through our grants program by having a specific criteria piece on it, ensuring that those most closest to the problem are closest to the solution, engaged from the get-go in your collaborative, and those, especially with lived experiences, have a seat at your table as you're working towards your systems change. This can also be reflected with a specific focus on a particular health outcome population or community that you know has the greatest health disparity. And this is the connection to the health outcome criteria. So you might be working to, say, improve diabetes rates in Arizona. What would want to do eventually as part of your health equity criteria is focus in on those populations and communities that have the greatest health disparity, as the disaggregated data shows apparently, especially to focus your work with that health equity lens. And then the fifth criteria is a budget that is consistent with the scope of work. In this instance, the technical assistance grant is a grant that can last for up to 1 year and can cover expenses for collaborative capacity building up to $20,000. We have it as up to 1 year and up to $20,000 because we really try to work with with the lead entity and the collaborative to identify the specific capacity building needs that you have, and in many instances can connect you with a strong local consultant that can help you address those specific capacity building needs. So your capacity building need could be a lot of different things in the whole spectrum of capacity building, on what would strengthen your collaborative to be in a better position to plan and implement your systems change. And that work might be smaller in scope. So it might be a smaller time frame and a smaller grant amount that would cover, say, the compensation of a consultant or provide convening support or things like that. So it might be less than $20,000, but the grants can go up to $20,000. The grant review process for the technical assistance grant again starts with the discovery intake form. So if you find alignment with Vitalyst mission with the technical assistance grants, you would complete a discovery intake form, which you can find on our Partnering with Vitalyst webpage on our website, vitalysthealth.org. Complete that discovery intake form. Once we review it and there is alignment, you'll receive a Calendly link to schedule a time to chat with a Vitalyst director. That is usually around 30 or so minutes, virtual calls via Zoom, to have that staff discussion or to have that initial discussion with the director. Once the director sees a potential that there is alignment with this grant, then they will work with you and connect with you with a consultant if needed, to begin to work on your application or your proposal, which is a 1 or 2 page proposal and describing how your project and effort meets each of those 5 criteria pieces of the grants. Remember, a collaborative to improve a health outcome with the system change lens, a health equity lens, and a budget that matches the proposed scope of work. So we will, if there is alignment, you are then asked to draft that proposal, and the staff, and there might be some kind of back and forth to ensure that your proposal is as strong as possible and as aligned as possible with the grant criteria. And if so, and once it's in a position to advance, that director will invite you to submit the application formally and then share a link to do so via our grants management system online portal. Once we receive that, that commences our internal review process that includes a staff discussion, where we review kind of as a team the funding and whether to recommend for funding or not. At this point, there might be some additional feedback or questions that our team had, so that director would circle back with you to maybe strengthen your proposal and then bring it back. Or it might be, we're just not seeing the fit here, so it might be declined for funding or refer to another resource. For the technical assistance grants, we review these throughout the year through the discovery intake process. There is no formal grant cycle or grant deadline for the technical assistance grant. We simply have an internal review process. So as the director determines that they've invited you to apply, and then we went through the review process, that usually takes about 2 or 3 weeks for internal review process. And if we reach consensus on funding, then that grant disbursement is made pretty soon thereafter. So it can happen pretty rapidly. The only real deadline that we're up against is our budget capacity and whether or not we have funds total for technical assistance grants. Our next grant is our Spark grant, which is the second tier of our three-tier grant cycle. So once that collaborative has spent some time to build up their capacity, they're in a stronger position. They are probably in a better position to apply for our Spark grant. So our Spark grant is more of like a planning grant, so that collaborative that has been formed and their capacity has been built can spend some time to plan towards their systems change. So think of this as a little bit more strategic planning, especially to really think about what are the specific interventions or solutions that are systems level that we want to work on and spend some time planning that out. So think of it as like a planning grant. You'll see here it's the same 5 grant criteria, but the description is a little bit more meatier in certain areas. For instance, the collaborative. At this point, right, hopefully you have built your capacity, maybe using a technical assistance grant. So you've already identified more partners. You need at least 2 in this instance, and the collaborative has to be formed serving Arizona. Still has to be working towards a health outcome, framing it using the will, and probably clarifying a bit more specifically what the health outcome is, not just the general health system that you're hoping to improve. And then for the system change criteria, right, this collaborative is just advancing a little bit towards their system in the system change continuum. So this is where you plan your systems change interventions a bit more fully so that by the end of your grant period, you have a pretty robust plan and then are in a better position to implement your solutions. For this Spark grant, the budget criteria, again, proposal has to be consistent with the scope of work, and it's a 1-year grant of $25,000. The Spark grant review process is very similar to the technical assistance grant. You would go through the discovery intake form if you find alignment with the Spark grant. Complete that form, we'll review it, and as aligned, you'll be prompted to schedule a time to chat with the Vitalyst director via Calendly. And again, they'll have this back and forth with you to better understand the alignment, review a draft proposal with you, and then if after that staff discussion, again, if there is fit, invite you to submit that proposal via our grants management system and for online portal, where then we'll go through our internal review process. In this instance, the Spark grant and the systems change grant have to go to our board for final approval. So this is where we actually do have grant cycles and grant deadlines. So this fiscal year, we had a fall deadline that passed. It was in October, and the next opportunity would be the deadline is May 7th of 2026. So we have a good amount of runway to be able to have those discovery conversations to determine if the Spark grant is aligned with where you're at and review proposals and then invite you to apply and by that deadline. While the deadline is in May, the funds will be dispersed in this fiscal year, which for us ends June 30th. So it's a pretty quick turnaround on the funds disbursement. And as I mentioned, it's for a year. So the grant cycle would run into 2027. The third tier of our 3-tier grants program is the system change grants. So hopefully the collaborative has built up its coalition, the collaborative has built up its capacity, perhaps with the technical assistance grants. and then planned towards their systems change, really thinking through the specific interventions or solutions towards systems change that the collaborative is going to advance, maybe with the Spark grant, and then be in a better position to apply for the systems change grants, which is essentially an implementation grant. You have a multi-year funding opportunity in this instance to help implement your specific solutions. You'll see again the same 5 grant criteria, but in this instance, a lot more meat to the bones. So with the systems change grant, you know your solution and intervention, you're ready to implement it now. So your project design is set, and maybe that's what you spent some time working on with the Spark grant. You know, you have the right partners at the table, you know what activities you want to deploy, and especially as it connects with systems change and the project. So this piece of it is really, really strong, as is the collaborative criteria. At this systems change grant stage, your collaborative should be pretty firm. You might continuously add new members and whatnot, but the core members, those that are really have a specific role and responsibility to advance your system change, they're at your table. So the collaborative piece is also a really strong aspect of it. Again, more than just a couple partners needed on this one. Continue to frame your work to improve health outcomes, especially using the will, and probably even getting a bit more specific with the specific health outcomes and specific populations and communities you're working in. And of course, as I noted, tying that in with the health equity lens, also continuing to engage community and those members with lived experience, so they continue to be closest to the solution. And then the budget for this one here, and similarly for the Spark grant, which I forgot to mention, we provide a budget template for you to complete that can help guide what your budget looks like, showing how the scope of work is consistent with the budget. In this instance, we also think through what the total anticipated cost of the systems change project in total, so that we can be as helpful as possible with helping secure other funding from other resources and being a referral as we can, but so that you all are really thinking that our systems change work is far bigger than what our 3 grant types at Vitalyst can support. So really keeping that systems change big picture thinking in that instance. The systems change grant is a 3-year grant of $175,000 total. So in that budget, you would reflect on year 1 expenses, year 2 expenses, year 3 expenses, that total $175,000. We highly encourage folks to go through our discovery intake process to, if you see alignment with our systems change grants as well. But as you'll see, as we open up our annual grant cycle, in this case, since it's a once-a-year grant cycle, folks have the opportunity to submit directly without having a discovery consultation call. We highly recommend scheduling the discovery intake call so that we could really work with you to determine if the systems change grant is really where there's most alignment, or maybe if we need to back up for the Spark grant or even to the technical assistance grants. So we really, really do like to have that dialogue through the discovery process, but it's an annual grant cycle that is open and anybody can apply. You don't have to be invited to apply for the systems change grant. But still, we highly encourage the discovery call to really help strengthen your proposal and make it even stronger if you do decide to apply. In this instance, a director will connect with you. You have the opportunity to draft the proposal, and we'll review it with you to see how it aligns with our grant criteria, and help you find areas to strengthen it if that is the instance. And then once it's submitted by the annual deadline, then we go through our internal review process, which includes an internal our team review and submission of an application, and then our grant review team, which includes some members of our board of trustees, scores those, and semifinalists that score the highest and get strong feedback from our review process are then invited to present their proposal. So a select semifinalist from the original written application submissions are invited to present their proposal, which is a 30-minute virtual call for those semifinalists. We score those presentations, merge the two scores from the written application and the presentation, and then ultimately recommend to our board which to fund for the 3-year grant of $175,000. Because this also has to go through our board and is a little bit more extensive of a grant process. It's an annual grant cycle that happens in the fall. So even though it is in the fall of 2026, we still are happy to have discovery consultation calls with you now and into the early part of next year so that you can, if aligned, queue up that opportunity for the fall. It's in our next fiscal year, and we haven't yet set that timeline, but it generally is the fall. Again, the discovery process will be open all throughout the year, so we'll be able to have those initial consultations. We usually open up the grant cycle with a virtual information session that I host live. That's usually in around August or September timeframe. And then this year's due date was in mid-October, just to give you a frame of reference for the timeline. So that deadline has passed, but again, we are still happy to have those discovery intake calls with you and discover if that is the best aligned grant partnership opportunity. So that gives you kind of a big picture with a little bit of a deeper dive, especially into our grants on the way that Vitalyst operates as a foundation, both with our fiscal sponsorship, TAP AZ, with our grant program, the 3 tiers, technical assistance grant, Spark grant, and the systems change grant, and then also our priority programmatic areas around healthcare, housing, and civic health. With that, I stopped screen share, so I see some great faces and a lot of familiar names. Happy to first turn it over to Michelle to reflect on any questions that were posed in the Zoom room.
No questions in the Zoom room.
No questions. All right, if you have any questions, feel free to continue to use the Zoom room or simply raise your hand and take yourself off of mute to ask your question live. Yes, Denisha, how are you?
Great. I started to type and then I was like, Never mind."
Here
Um,
we are. Why not?
if an organization finds itself fitting in multiple places,
Mhm.
is that something that can be help be figured out during the discovery process? Because you want to sit in the right spot. So you may see something, but then it's like, but I also see this. So do I
Mhm.
submit for both? Like, how does that work?
Absolutely. Yeah, that's exactly why we have that discovery process to be able to have those frank conversations and be like, you might be advanced in this certain criteria, but you need a little bit more in this area. So let's actually put you in the technical assistance grant, say for instance, and then work on that specific issue and then be in a better position for the Spark grant or the system change grant. Um, that raises a concept that I didn't say is you don't have to start at square one with the technical assistance grant. So if your collaborative is already formed and you're built and you're ready to plan, you can jump straight to the Spark grant, right? You don't have to get the technical assistance grant first. So we would queue you up for the Spark grant. Similarly, if your collaborative is formed, your capacity is built, you've done your planning, you're ready to rock and roll, you would jump to the system change grant and go through that process. You don't have to first get the technical assistance grant, then the Spark grant and the systems change grant. So you could jump into any lane as it fits. And that's exactly, Denisha, why we have that that discovery call. We also do not leverage multiple we don't run two trains for approval for the same entity that's working on the same systems change project. We really do try to align you with which project makes sense. At the same time, if you are an existing Spark grant or system change grant partner that is trying to troubleshoot a specific collaborative issue or need to address a capacity building issue in your collaborative, you might still qualify for the technical assistance grant. So in that instance, you might be able to tap into the technical assistance grant in addition to your Spark grant or the system change grant. But again, we would work with that partner through the discovery process to really think through that. Great question.
We have a great question in the chat. Melissa, we'll go there first, then other people can put in the chat or raise their hands. So the question is, can you share some examples of previous other system change that were developed? Wondering in what way will we change the system and at what level?
Yes, if you go to vitalysthealth.org on our grants and partnership webpage, you can see from years and years and years back, like 10 years or so of grant partners, both for our system change grant and then our Spark grant. The technical assistance grants aren't noted in there because, again, we just streamlined that to support collaborative capacity building. So we're still building out those great partners. So you'll be able to see great examples of the system change grants folks and then Spark grant folks. We have had some, especially as of late, Spark grant partners that have applied for the system change grant and gotten it. So that's exactly kind of how we built the grant partnership opportunity. It's not automatic. You still have to go through the application process. We really want to make sure that you really are complete with the technical assistance grants before you go to the Spark grant or the Spark grant to the systems change grant. So that's where the discovery call comes into play as well. Michelle, actually, do you have maybe not a favorite grant partner because it's sort of like a favorite kid, but is there a systems change or Spark grant partner that you've just been really, really impressed with?
Yeah, I think the most recent one, so awarded last year, fourth trimester, is one of my favorites right now. So they're trying to raise awareness to lactation support and providers and broaden that scope. So they want looking at insurance reimbursement because not all insurance will reimburse that service, but they also want cultural aware competency. So trying to get more cultures to be certified to be lactation providers and consultants so then they can help their community and have that cultural background and just provide that level of support, meeting people out there where they're at. So I think that's my most recent favorite.
Great answer. And again, if you go to that partnership webpage, you'll be able to see highlights. For this last grant cycle, we had 4 grant partners that we worked with them to create professional videos to better tell their stories, especially as it connects with the 5 criteria so that you could even see, oh, this is what we mean by systems change. This is what we mean by collaborative, et cetera, et cetera. So check out those videos. They're also on YouTube. So they're really, really cool and really well done. Another thing that I really appreciate about this, about many classes of our systems change grant partners, but especially this last one, is the diversity of issues we're tackling. So to your second question, the system that you are working in can again reflect the will, right? And in specific elements of that will. And when you're thinking about, okay, what is the system to be changed? Think about what entity, or maybe it's a who, is holding the problem in place that is making it harder to do our job and see our mission and programs through, right? And maybe not directly programs, but holding that system in place, the problem in place, so that we could address that root cause of the challenge. That system often does include some sort of government institution, but it could be healthcare systems, regional food systems, the nonprofit ecosystem, and we have examples in each of those areas where from past systems change. So it doesn't always have to include government institutions, but it often does because government institutions are so many barriers for a lot of different reasons on why they are holding the problem in place.
I have a question,
Yeah, go for
David.
it.
Hi. So I was wondering, I have two questions. One, are most of the agencies you work with larger, or do you work with smaller nonprofits that have from 10 to 15 or 20 staff and but serve many people because of the area? Uh, And also, do organizations normally start as at the Spark grant or start at technical assistance and then transition over, or vice versa? I was a little bit confused on that part of it.
Sure. Two great questions. The first question, we work with a wide variety of partners, both smaller grassroots organizations that are playing the lead role in that collaborative. A great perfect example of this right now is um, uh, gosh, okay, now I'm trying to think, are they going through our current app? I think they are going through our application process. But it really depends, which is still in review. Is it the lead applicant? A big question about it is like, are they the right partner to be leading the effort? A great example from a previous system change is Black Lives Matter Phoenix Metro. That effort is tackling the criminal justice system, especially in the city of Tempe criminal justice system, and they are leading the effort because it's core to their service model. But they have gained the respect and trust of the city of Tempe. And are at the table of all these community advisory boards and ensuring community voices are heard in the Tempe judicial system. So they are working with the city and community partners, leading that effort to implement restorative justice systems change in the city of Tempe. So they are a community partner, smaller grassroots entity that is taking the lead, but working with institutional partners that are driving that systems change. Very similarly, another restorative justice systems effort that we're supporting is down in Pima County, where the lead partner is actually the Pima County Attorney's Office, working with the Defender's Office and other community partners. So similar issues, but they're taking completely different approaches. So we work with a wide variety. Also, this is where the discovery process, again, is really helpful, including with the systems change grant, so that we could actually work with you to strengthen your proposal as much as possible, even if you don't have a full-time grant writer or
Right,
fundraising leaders. Also, in the
right.
system change process, this is why we have both the written application and the presentation, because a lot of these grassroots community-based partners that submitted the application don't have a full-time grant writer. So the written application might not be as strong as it can be, especially against some of these larger
Mhm.
institutions, right, that have like a 10 to 20
Right.
member fundraising team, but they sure can tell their story.
Mhm.
So then when they're invited to present, it is amazing. And that's why we also have different, we do a scoring of the written application and then a scoring of the presentation, because in some instances we've seen a jump, especially from those community partners, because they sure can tell their story really well. Um, and then to your second question, sort of what order, right? So
Mhm.
again, this will be kind of part of the discovery calls to really
Process.
just
Okay.
work with you through based on where we see your project at and maybe initial reviews of our proposals, is really thinking through right now you're best suited for a technical assistance grant, or no, you're ready. Let's get you up to the Spark grant, or maybe even let's get you in the queue to apply for the system change grant. So it really depends on kind of where you're at.
And then I'm sorry, one more thing. So I just, in 26 years in behavioral health, I've worked for really large organizations, and the larger organizations do usually get the grants because they're large. They have a huge team of grant writers and, a whole fundraising department.
Mhm.
Now, at a smaller organization who's making great strides because we have partnerships with like ASU and NAU, things like that. But I am seeing that um, the smaller organizations really face a lot of challenges when they don't have professional grant writers. So do you see that happening very often where smaller organizations that don't have grant writing departments are able to utilize the discovery process to identify what needs to be done?
Yeah, yeah, absolutely. And our team has done a lot of work across the sectors, as you see, healthcare, housing, et cetera. So also can connect you with other partners and other groups that might eventually become part of your core collaborative, and ensuring that those core partners are um, are at the table and make those warm connections. So definitely are a bit more hands-on with that. We, of course, can't build your coalition or can't write
No,
your
yeah,
grant for you, but definitely provide a lot of upfront technical assistance. Also, for the technical assistance and the Spark grants, it's like a two-page proposal, so hopefully it's not too heavy of a lift. The systems
yeah.
change grant is a five-page proposal, so again, not too heavy of a lift. And then you have that presentation piece if you don't have a professional. And we have an evaluation rubric that is also posted on our website. So you see exactly what the grant reviewers are looking for
Scoring.
to strengthen
Mhm.
a proposal. And there's not a criteria about the size of an institution. It really, though, is about the capacity of that lead applicant to be the lead, and the sort of the reasoning why they are the lead and maybe not another entity. But again, it's not because they're too small or they're big. And in fact, in many instances, we question bigger institutions. Why are you the lead applicant? And especially when we're looking at big institutions like universities or colleges, and
Mhm.
really ensuring that with that health equity lens, that the community is at the table from the get-go.
Right. Thank you. I
Another
appreciate
thing I'll reflect on is we don't have any thresholds or very many restrictions with our budget. So there's no like threshold for indirect. And we recognize that systems change work is heavy work. It takes a lot of human resource. So there's no threshold on the amount of the grant that can go towards staff. We do look at, okay, what proportion of the total grant funding is going to that, to ensure you have funding for other expenses that will be
Right.
important to advance your work. But that is another way that we really ensure that the community partners are supported. And we allow
Okay.
for and encourage like community stipends, honorariums, subcontracting, subgranting to be able to reflect that as well.
Thank you for that. That makes a lot of sense. I appreciate that.
Yeah, great
And we do
question.
our own grant writing, and so that's what we're not professionals grant writers, but we have been able to obtain grants. It's just that, yeah, that
Yep, yep.
it's challenging.
You're a professional in lived experience.
Yes, yes. One of the first family support partners in the state. Yes.
Amazing. Denisha, you have a follow-up question?
Yeah, you made me think of something.
Yeah.
So, um,
And just
I
really
understand.
quickly, sorry to interrupt you. I recognize it's the top of the hour and some folks are zooming back to back to
Oh,
back.
okay.
So if you have to jump off, no problem. I can stay on for a little longer. We're going to continue to record this. So if you do have to jump off, you'll still get the recording and follow-up material. So if you have to drop off, no problem. Thank you so much. Sorry for interrupting, Denisha.
Oh, you're fine. A bit of a two-part about post-award technical support. So you're working with helping to build up to make sure it's a solid application and the plan makes sense. Two parts. One, have you found in the capacity building segment that it's taken someone more than a year to get the capacity building to where it needs to be? And then the second part, is there technical assistance best practices tools that come with a grant award that could help ensure that they can reach the right point in a year?
Totally. Yeah, there have been some instances where we have entertained more than one technical assistance grant to help really ensure that that collaborative is in a strong position to plan and implement their systems change. We have only seen that a couple times because of the newness of our technical assistance grant supporting specifically supporting collaboratives. And the timing really kind of depends on what the specific capacity building need is. So if it goes on beyond a year, we are happy to we have provided no cost extensions to grants and really help you address the issue and have flexibility on that front. Also, once folks become, if they are receive a grant from Vitalyst, we have a whole stewardship plan for all of our grant partners. All of our grant partners are invited to learning sessions that are focused on collaborative building and systems change thinking. Those are hosted regularly, both virtual and in person. We have a whole orientation for new partners that go through that stewardship plan and all the additional technical assistance that Vitalyst provides either in-house or through contracted services. For instance, all of our partners, if they're not yet members of our statewide alliance of nonprofits, we offer a free membership, free year membership to them. And by becoming members, you then receive all of those inclusive benefits, including access to other capacity building workshops, access to grant portals, and other things. We often invite our partners to events and conferences that we're part of. And if there are conference expenses like registration fees, we will extend that and a scholarship for our partners as well. So we layer on the love, but we try not to smother you all because we recognize we're still a funder and we just kind of want to get out of your way and let you do you. So that's kind of a mentality we follow. Yeah, thank you. Any other questions? Awesome. Well, hopefully you see that we are accessible and open. So even if you do have additional questions, feel free to complete the discovery intake form. We'll receive that and then schedule a time for us to chat. Thank you all so much for joining us for our December virtual monthly meeting. You'll receive the recording and follow-up materials. And we hope you have a great holiday season. Be safe and healthy. Take care.